Hi, I'm Krista Hughes, the founder and CEO of Hughes Advocacy, in which I am a board certified patient advocate. I'm also an educator at the Leapfrog Judy Burroughs Education Institute. It's the educational arm of the Leapfrog Group. Leapfrog is an independent, nonprofit organization that rates hospitals and ambulatory surgery centers on how safe they are for patients. So today I want to talk to you about two free tools that help you choose safer care. So first is Medicare's Care Compare, and the second is the Leapfrog Group. Think of these as your headlights before you drive into the healthcare system. And these are wonderful tools if you're age 55 and older. So the first tool is a federal tool, and it's called CMS Care Compare, and it's on the Medicare.gov website. It lists quality information on hospitals, doctors, rehab facilities, etc., nationwide, even if you're not a Medicare patient. You can type in your city or zip code, pick a hospital, a doctor, a dialysis center, and see how they perform overall. You'll also see an overall star ratings from 1 to 5 stars. Now, more stars generally mean better quality across several areas. You can even pick up to 3 facilities and compare them side by side. So how do you use this website? So you'd go to the Medicare.gov Care Compare and choose a hospital, for example. Enter your zip code and hit search. Once you find a hospital, click on it to open it. And there you're going to find information like complications and death, timely and effective care, maternal care, etc. Now, the second tool is available on the Leapfrog Group website, and it has 2 functions. The first is the Leapfrog Hospital Safety Grade, which is basically letter grades. They publish a hospital safety grade, A, B, C, D, or F. And they focus on preventable harm, like infections, medication errors, falls, and so on. It's updated twice a year, and it's designed to be easy to read at a glance. A would obviously be the best rating. So how do you use it? You would search for your hospital on the Leapfrog Hospital Safety Grade site. If your hospital has a lower grade, click into the details to see where that hospital can improve. You also can click, when you're in that letter grade, you can click the view the full score for additional information that will open up to show you things like infections, problems with surgery, safety problems, and so on. The second function of the Leapfrog Group is the Leapfrog ratings for hospitals and surgery centers. Leapfrog also rates ambulatory surgery centers and hospital outpatient surgery. And why that matters is because today most surgeries in the US happen outpatient, often the same day. So you want safety in there too. So how do you use it? Well, you go to the Leapfrog's Hospital and Surgery Center ratings page. You can search by location, facility name, or in this one, you can even look by procedure. For an example, a total knee replacement. There's also maternity filters, like whether the hospital meets standards for C-section rates or newborn jaundice screenings, so that expecting parents can make informed choices. So here is kind of like 2 real life examples. Example 1, you're planning on having a knee replacement and you have 2 nearby hospitals in mind. So first you go to the Medicare.gov Care Compare and you see that hospital A has 4 stars and hospital B has 3 stars overall. So then you would open the comparison to look at like readmissions back into the hospital and patient experiences for surgery patients. Then go to the Leapfrog Group to look up both the hospital's safety grades and say hospital A had a B and hospital B had an A. You then click into the details and you see that hospital B has stronger practices to prevent surgical infections. But hospital A tells you they're doing more to stop preventable harm. After doing your research, you choose and decide that hospital B, because that is what was important to you, is the infection rates. And then you will want to bring these findings to your surgeon to discuss. Now, example 2, you're expecting to have your first baby and you want a hospital that supports safer births. So on the Leapfrog's rating page, you select maternity care, turn on filters that shows hospitals meeting standards for lower C-section rates or good newborn jaundice screenings. And you notice that your first hospital choice meets the less than 23.6% C-section benchmark, while the second option does not. Then you go to the Medicare.gov Care Compare to double check to review patient experiences and overall star ratings. And after researching both tools, that should give you confidence in picking your choice. Then at your next doctor's appointment, you can bring specific questions to your OB about policies that support vaginal birth and early breastfeeding. Now, I use these tools every single day with my clients to help them make informed medical decisions. I think they're wonderful tools. So what do these tools do and do not do? They do show patterns of how hospitals and surgery centers perform on safety and quality. Use them to start a conversation with your doctor. They do not replace medical advice. In an emergency, go to the nearest appropriate facility. Now, factors like your specific condition, the distance, specialist availability, and your care team's recommendation are things that still matter when picking what is best for you. So here's a simple checklist. 1, look up your choices on Care Compare for overall quality and patient experiences. Then go to Leapfrog and check the hospital ratings A through F. Aim for an A or a B, then read the details. And if it's an outpatient surgery, search Leapfrog's ratings for that procedure. Number 3, bring questions. Ask, how are you preventing infections? What's your plan to avoid medication errors or falls? Do you meet Leapfrog's maternity or safety standards? The bottom line is, if you give 5 minutes on these sites before you schedule, it can help you choose a place that's safer, more transparent, and a better fit for you and your family. Use the data, ask direct questions, and make the system work for you. For more resources, please visit the Leapfrog Judy Burroughs Education Institute. And if you have any questions for me as a patient advocate, please reach out via my website at hughesadvocacy.com. Thank you and have a great day.